Good afternoon, everyone, and welcome to today's webinar, The Financial Lives of Young Adults, Exploring Disparities by Race and Ethnicity. My name is Thea Guerin. I'm a Senior Director at the Financial Health Network, and I'll be welcoming you to today's discussion, but I'll quickly turn things over to my colleague, Carla Henriquez, and the wonderful group of panelists that we've invited here today to review some of the key findings from a recently released report that we put out along with Gen Forward, and to discuss what some of these key findings mean and implications for how they can be used to improve the financial lives of all people in America, with a particular focus on young adults. So by now, I imagine that all of you are quite familiar with Zoom, but I do want to take a moment to highlight some of the logistics from today's platform. All of you have joined in listen-only mode, but we will encourage you to submit questions via the chat box on your screen. We'll pause for questions at the end of each section, but really would encourage you all to submit questions as they occur to you throughout the presentation. For those of you who would like to access closed captioning, you can do so following the instructions on the left side of your screen. At the Financial Health Network, we abide by, and we expect our listeners to abide by, the spirit and the letter of antitrust laws. So this is more or less how the next hour or so will go. I'll spend a few more minutes welcoming you, presenting some opening remarks for today's session. I'll then turn it over to Carla to walk you through the methodology we used to derive the key findings from the report. She'll spend a few moments diving deep into those key findings, and then we'll leave about half an hour or so for the panel discussion, discussing the implications, of some of these key findings. I'll then come back on and wrap up with a few ways that all of you can engage further with this data and with our organizations. So for those of you who are unfamiliar with us at the Financial Health Network, we are a national nonprofit organization whose mission is to improve financial health for all. And we do this in a few key ways. We conduct original consumer and market research. We offer one-on-one consulting services to companies looking to bring innovative products to market. We offer seed funding for fintech startups as well as nonprofit organizations. And we run a network of innovators, financial institutions, financial service providers, healthcare providers, employers, and others, all committed to improving the financial lives of their customers, clients, and employees. The report that we are eager to spend a few minutes on today is this recent report that I've mentioned a few times now, called Race, Ethnicity, and the Financial Lives of Young Adults, Exploring Disparities in Financial Health Incomes. And in partnership with our colleagues at Gen Forward, a research group housed out of the University of Chicago, we released this report a few months ago, which is focused on exploring disparities by financial health outcomes among young adults by race and ethnicity. And while we had planned to do this research for a while now, the report ended up being released at a really important moment for our country. In the midst of the COVID-19 crisis, which has disproportionately affected Black and Latinx communities, months after the George Floyd protests shined a spotlight on the legacy of enduring structural racism in this country, and weeks before a new administration that has promised to address the effects of this ongoing structural racism begins in Washington, D.C. And so we're hopeful that this research will help a variety of stakeholders across the financial health ecosystem to design programs, policies, and solutions that can help close the financial health gap between Black and Latinx young adults and their white and Asian American peers. So before passing things over to Carla to explore some of the key findings from the report, I want to take a moment to thank our partners at Gen Forward, specifically Kathy Cohen, Matt Fowler, as well as Jonathan Likes, who we're thrilled is here with us today and will be moderating the discussion in just a moment. And Gen Forward not only facilitated the execution of the original research that's included in this report, but the Gen Forward team was also instrumental in bringing their years and in some cases decades of experience and expertise to the analysis and the writing of the report. So we benefited extraordinarily from our partnership with the Gen Forward team, from their expertise and experience. And we hope that this is the first of many opportunities we have to partner with the team over there. So without further ado, let me turn the presentation over to Carla, who's going to preview some of the key findings that you can see on this slide, then share a little bit about the methodology, dive deeper into the key findings, and introduce the panel discussion in just a few minutes. Carla, on to you.
Awesome. Thank you, Thea. And thank you all for joining us today. Some of our key findings from this report are Black and Latinx young adults have less liquid savings and more unmanageable debt than their white and Asian American young adults. We're also found that the enduring racial wealth gap continues to hinder the ability to build wealth through generational transfers. And last, we found that Latinx young adults are less likely to have confidence in their long-term financial goals and insurance compared to others. Next slide, please. And in order for us to collect this data, next slide. We partner again with Gen Forward, who helped us design this survey that was fielded by NORC at the University of Chicago. We were able to survey 3,133 participants from May 29th and June 11th across all these demographic groups. Next slide. The financial health framework is based on these 8 indicators of financial health. For every respondent who answers 8 survey questions that align with these 8 indicators, we can calculate 1 financial health score and 1 sub-score that aligns with the 4 subcategories of spend, save, borrow, and plan. Next slide. This slide shows how to interpret the financial health scores. Financial health scores and sub-scores between 0 to 39 are considered financially vulnerable. These individuals are struggling across most, if not all, of the indicators of financial health. Financial health scores and sub-scores between 40 to 79 are considered financially coping. These individuals are struggling with some, but not all, aspects of their financial health. And last, financial health scores and sub-scores between 80 to 100 are considered financially healthy. These are individuals who are spending, saving, borrowing, and planning in ways that will allow them to be resilient and pursue opportunities over time. Next slide. And now let's dive deeper into these findings. First, we can see the different levels of financial health between Black, Latinx, white, and Asian American young adults in this slide. Our first key findings saw that Black and Latinx young adults are less likely than their white and Asian American peers to be considered financially healthy. Disparities across nearly all the 8 indicators are driving differences in financial health outcomes among young adults. Next slide. More than half of Black and Latinx young adults say that they do not have enough savings to cover at least 3 months of living expenses, compared to 48% of white and 32% of Asian American young adults. As you can see from one of our participants' quotes, it is not that Black and Latinx young adults are not saving. 44% of Black respondents and 46% of Latinx respondents said that they have less than $5,000 in savings, which might not have been enough to cover financial shocks like those created by COVID-19. In our report, you can see more details of how COVID-19 has affected young adults. For example, 27% of Black and 26% of Latinx young adults said that they had lost their job due to COVID, compared to 16% of white and 70% of Asian American young adults. The pandemic has also caused rent burden among Black and Latinx young adults, with 31% of each of these groups saying that the pandemic has made it very challenging to pay for rent. Next slide. Go back one slide, please. So while that updates, our second key finding found that the Black and Latinx young adults are having more unmanageable debt compared to their 22% of white and 70% of Asian American young adults. 31% of Black and 28% of Latinx young adults say that they have unmanageable amounts of debt. And as you can see, once we get the slides back on, this prevents young adults from making other life decisions. We found that it was really challenging for young adults to be able to continue their education, buy a home or a car, or save for retirement. The debt burden was that much that it prevented them from making other life decisions. Aside from general debt, we also saw that there's a huge student loan burden also for Black and Latinx young adults, with 36% of Black and 28% of Latinx young adults having unmanageable amounts of student loan debt. Next slide, please. Our third finding saw a slightly higher percentage of Black and Latinx families being able to help cover small expenses like an unexpected bill of $1,000, compared to bigger expenses like buying a home or paying for education. Yet Black and Latinx young adults are not able to receive support from their families for wealth building opportunities in the way that white and Asian families are able to. Next slide. Our final finding saw that Latinx young adults were the least confident in terms of long-term financial goals. 56% of respondents did not agree with the statement that their family plans ahead financially. We also saw gaps in Latinx and Asian American respondents on insurance coverage. 68% of Latinx young adults and 63% of Asian American respondents are not confident that their insurance will provide enough support in case of an emergency. And with that, these are all the key findings of our report. I will welcome you to add any questions you might have about these findings in the chat or the question and answer section. Yes, so we did define young adults as ages 18 to 36. That is a little bit of a wide window, but we were able to capture most of the millennials and the start of Gen Z who are going off to college and are leaving the household. Thea, do you have anything else to add? No. So I have another question was how many respondents we had. Again, we had 3,133 survey respondents. Okay, great. So keep the questions coming. If we're not able to answer them now, we will definitely be able to cover some of these follow-up questions on our panel. So I'm gonna pass it on to Jonathan to introduce our panelists.
Greetings, everyone. So excited to be here with you on this Tuesday afternoon. My name is Jonathan Likes. I'm Director of Programs and Partnerships at the Gen Forward Survey and Black Youth Project. I'm so excited to introduce a wonderful panel to you all today. And there literally probably is no better time throughout history to be talking about the financial health of young people than the December after one of the most important election in many generations, the December of the year of one of the largest economic crises many of us have experienced in generations, and one of the largest uprisings many of us have ever experienced in the United States. So we're having this conversation on such an important platform that we want to dive in right away. So I want to open up the discussion by just having each panelist say their names and their backgrounds and what they do. And let's start with my colleague Vlad, research consultant for the Gen Forward Survey and professor at University of Delaware.
Hi, everyone. It's a pleasure to be here. Thank you to the Financial Health Network and everyone involved to organize this. And thank you to all of you who are in attendance. My name is Vlad Medenica. I'm a researcher at the Gen Forward Survey, and I'm also an assistant professor at the University of Delaware. And I study the attitudes and behaviors of young adults, paying close attention to race and ethnicity. Really excited to talk today.
Thanks, Vlad. AT?
Hey everyone, thanks so much for having me. My name is A.T. McWilliams. I'm the COO at Equity. Our company disperses cash grants to college students who are facing financial crises. So whenever there's a student who is working or attending one of our partner schools, they can apply for a cash grant through our app, and it's funded by their college. So I've been with the company now for a little over a year. Most of what I do is support our partner success team, which helps out our college partners, and then also our product team, just to make sure that our app is functioning properly. So yeah, I would love to provide some insight into our work, especially as it relates to racial justice and focusing a lot on Black and Latinx students and who we're providing funding to.
Wonderful. And Carla, do you want to, I know you already introduced yourself. Do you want to talk about anything else that you do at the Financial Health Network?
Yeah, real quick, my name is Carla Enriquez, and I'm a senior associate at the Financial Health Network, and I've been doing a lot of work around our nonprofit FinTech exchange under the Financial Solutions Lab, and also working with our workplace team to create a lot of those, a lot of the tools that we hope employers can utilize in the future to increase the financial health of their workforce.
Fantastic. And we'll just start out with you, Carla. Can you just talk a bit more about how the key findings present in your current work? And then we'll have the full panel answer that question. Just how do the key findings show up in your work? What implications does it show?
Sorry, you always forget to.
All good.
So. Yeah, I think one of the things that's really interesting for our work, as many of you might know, we release the Pulse report every year, which talks about the financial health of all Americans. But this partnership with Gen Forward has really given us the ability to look closely at this specific group of individuals, especially as it relates to race and age. I think that one of the really interesting parts is to be able to tell a story and to be able to say with with this data, young adults are struggling, and how can we support our members, and how can we support all of the people in our ecosystem of financial health to really push forward policy solutions, products that actually are going to serve young adults. One example of what we see in this report compared to the overall polls is that only 22% of young adults are financially healthy, compared to 33% of the general population. So we really hope that a lot of our members can utilize this data and really think about how are their services and products serving this population, and how can they improve their financial health?
Thank you, Carla. Let's move on to AT. In your work with Equity, can you just talk about how these key findings show up in your work?
Yeah, absolutely. So it definitely comes as no surprise to me, and then I imagine most of us on this call, that Black and Latinx young people are struggling more financially than their counterparts. And this is something that we've seen in our work every day. The population of students that we support ultimately trends to be more students of color than not, simply because those are the students who, on average, are experiencing more financial crises. So in the case of one of our partner colleges, Western Governors University, we saw that compared to the general populace of 10% Black students, we funded roughly 20% of our overall students were Black that received our cash grants. So that's just more evidence that the money, one, is going to the students who have the greatest need, which is great, but also points out that we recognize racial justice is economic justice. We need to ensure that if we are to continue doing the work the right way, that the students who need that help get the most funding. One of the things that I think is challenging about these key findings is that you need the data to be able to make those decisions and be able to adjust the product and our approach to meet those students' needs. And that data is difficult to collect. Thankfully, we have partners who do collect racial demographic data. But when we think about us collecting it ourselves, there are some research-based issues, and let's say asking for racial demographic data upfront, which we know can oftentimes cause students to ask for less or skew them just from a psychological conditioning standpoint. So we are definitely not perfect in how we're collecting this data and using it. But one of the things that what our work has really validated in the key findings is that the students who have the greatest need for financial health are also the ones who are dealing with financial crises on an ongoing basis.
Vlad?
Sure. Well, first, I think I should introduce the work of Gen Forward a little bit more generally. So at Gen Forward, or the Gen Forward survey, what we do is we are a nationally representative bi-monthly survey of young adults, people between the ages of 18 and 36. And we pay special attention to race and ethnicity, right? And I think that some of the key findings we've talked about so far, and the larger conversation we're having today more generally, are really central to the work and mission of Gen Forward, which is probably best understood as consisting of two parts. The first part is that we aim to understand and to amplify the attitudes and behaviors of young adults, particularly young adults of color. And in order for us to do that effectively, right, it's important that we understand the lived realities of young adults, the larger context of their lives. And of course, a really important part of that context is one's financial health and well-being, right? The sorts of things that we're talking about today, because their economic circumstances can inform other important attitudes and behavior, like one's views of government or particular policy preferences, things like that. The second and arguably more important part of our mission is one that I've alluded to already, and that's really to highlight and explore the racial and ethnic heterogeneity that exists among young adults. And I'm sure we've all heard this popular characterization of young people as like lazy or entitled workers, that they spend all of their money on avocado toast. But to borrow a refrain that's become popular after this most recent election, young adults, like so many other groups that we talk about, aren't a monolith, right? In fact, young adults today are the most racially and ethnically diverse generations in history, right? If we're talking about the millennial generation and the sort of growing Gen Z generation, they're the most diverse in terms of race and ethnicity ever in the United States. And so it's important for us to lean into and explore that diversity if we really want to understand the challenges that young adults face and hopefully design effective policy interventions to address those challenges. And that's where we at Gen Forward come in, because as AT mentioned, right, these sorts of data just don't exist generally, right? And the data that do exist aren't very good. Sample sizes are really small. The sample sizes, are selective in terms of geography or what have you. And so we at Gen Forward try to fill that gap by having this large nationally representative sample where we continually survey young people to understand their views, their behaviors, and their lived experiences.
Thank you so much for that first round of answers from all of the panelists. So now let's just talk about the elephant in the room, what we're all dealing with, what we know there's going to be an additional spike after Thanksgiving weekend travels, coronavirus, COVID-19. And if you all could just from your own perspectives, your own purviews, how has COVID actually made it more challenging for young adults to be financially healthy in this time? And yeah,
I can get started.
sure.
Yeah.
Jump in when you can.
I think one of the things, and one of the things I'm glad we're all millennials, I believe here, so we all understand the looming student debt crisis. And I'm personally affected by student debt, and I'm sure many of you might be too. So I think it has been very nice to have the CARES Act being able to provide forbearance for student loans. That has been one of the things that has been alleviated some of the burden for a lot of young people. But unfortunately, the CARES Act and the forbearance for student loans was not available for everyone. So I think that definitely that's one of the challenges that we are seeing that is coming by the end of this month. So unless there's any government action, we're going to have another crisis coming at the beginning of next year when student loans are due again. One of the challenges we see is that a lot of people, especially Black and Latinx young adults, are not able to, or are not getting this information about the CARES Act, about forbearance, about income-driven repayments. So it's becoming really challenging for people to reach out, especially right now in COVID, where a lot of those connections that previously communities had, either to a community center, a community-based organization, those are not able to be the connections where people are getting their information. But this summer, we try to bridge up a little bit of that gap through our work with Student Debt Crisis and the Student Borrower Protection Center to identify areas of distress. We started with the Bay Area, and they were able to create a dashboard to identify those areas and work in the Student Debt Crisis or organization created a student resource center, and I will gladly add that link later on here, for students to go in and get all the information they need to know on how to get on those income-driven repayments, so they're ready once forbearance ends. And I think that is definitely a way that we can support our students and borrowers to get them ready before that December 31st deadline.
Thank you, Carla. So what we're seeing in 2020 is really this interesting contradiction between this narrative of either COVID capitalism policies or straight out socialism. So I want AT and Vlad to speak to this dynamic of what does it mean that literally some socialistic policies had passed this year? How has that helped people financially? And what does it mean if those policies don't continue to the future? And
Yeah,
go on, AT. Yep.
I can definitely speak to this. So, COVID has dramatically changed the work that our company does. We already knew going into COVID that 3 million students drop out every single year due to a financial crisis that amounts to about $500 or less. So we are not, new to the crisis that students face, the young people face every single day. And this is separate from tuition payments. We're talking about being able to afford food, being able to make your rent payment, being able to make your car payments. These are often the hidden costs that come with attending college that often lead to dropouts. When COVID hit, we found that roughly 80% of students across the country were impacted by this in some way. We still don't have the data, but soon we will be able to see how many students were left homeless, how many were left hungry as a result of COVID. The CARES Act, is right in line with what we're hoping to, propagate as part of our company, which is, giving cash directly to people without any conditions. So these no strings attached cash grants, are meant to be a reflection of a greater idea that, the best way to help people who are in need is to give them money. So we're personally at Equity very hopeful that more stimulus packages are passed, and these types of socialistic policies are going to not just be something that we see in the next year, but start a trend that stretches beyond COVID. And when we do have vaccines, when we do have people starting to return to normalcy, that we remember that a lot of the issues that COVID has brought to light have existed for decades, for centuries, and really are symptoms of a lot of systematic racism and institutional poverty that has existed for a long time. So I know that we're personally very hopeful that these packages pass, and also that a lot of that money is able to go directly towards students, especially in terms of offsetting tuition debt, but also those real college costs of purchasing food, finding a home, and purchasing textbooks, whatever it might be, to ensure that you can be successful while you're in school.
Thank you, AT. Vlad?
Yeah, I would say that what we've seen in terms of demand for, what you've called sort of more socialist or policies, I think can be directly connected to the sort of lived experiences of people today, right? So to your question about how has COVID-19 made it more challenging for young adults, or what are the effects of COVID-19 on the financial health and well-being of young adults? This isn't a great metaphor, so don't quote me on this. But the pandemic has been like filling up an old bucket full of water that's now leaking all over the floor, right? So the cracks and the holes in the bucket were there before, just like AT has mentioned, right? They're the products of the legacy of racial injustice, of racial discrimination, of all sorts of things. But now they're on full display, right? Because the bucket is full of water and it's just leaking all over the place, which is to say that the economic circumstances of young adults were precarious to begin with, right? So young adults were already, quote unquote, behind on their finances compared to previous generations, right? Gen X, baby boomers. The labor market for young adults, especially those who are Black and Latinx, hadn't actually fully recovered from the Great Recession of 2007, right? Which is when people who are now in their 30s first enter the labor force, right? So you have this whole cohort of people entering the labor force at a time that is going to have negative impacts on their long-term earnings and financial health and well-being. That's why, or it's at least one of the reasons why we've seen the rise of the gig economy, right? Where people work primarily as contractors for companies like Uber or DoorDash, things like that, and not as formal employees as people have traditionally, right? Now that we're in a second economic crisis, that's compounding the effects of the first, right? Because people who entered the labor force in 2007 still hadn't recovered. And now, we're affecting also a younger cohort, those in their late teens, early 20s that are also now entering the labor force for the first time during an economic crisis. On top of that, young adults are facing unprecedented levels of student loan debt because of increased educational costs, even though the expected returns of a college education are actually declining, right? That's something we've already talked about. They're effectively priced out of the housing market, which has traditionally been how people generate wealth in the US. They're disproportionately concentrated in sectors of the economy that have been hit hardest by the pandemic, right? Like service, hospitality, and entertainment. And on top of the sort of economic effects of the pandemic, they're more likely to be, young adults, and especially young adults of color, are more likely to be or underinsured when it comes to healthcare, right? So we're seeing, effects both on the economic side of things, but both in terms of people's health, which of course is intertwined with their financial well-being. This is especially true for Black and Latinx young adults. And so when we consider sort of this totality of experiences over the past 10 years or so and how they've shaped the context of young adults, right, that goes to explain this sort of demand for a more expansive safety net, right, for these policies that are aimed at supporting people who just don't have the opportunities to support themselves as previous generations had.
Thank you, Vlad. Very enlightening. And I love this metaphor of water spilling out of the bucket. I don't think it's any mistake. What I tell people is that you don't get an uprising in 2020 without the largest economic crisis in many generations and without uh, a once in 100 years pandemic happening. The uprising is a result of these dynamics happening in our society. So let's move on. And many of you, in naming the problems or the challenges or the struggles that young people are navigating, many of you have already implicated some of the policy solutions. But if we could just get at that question a lot more directly, what are, either on the policy or programmatic side, what are solutions that could absolutely change the future of young adults as we try to look for a generational change in the financial health, not just of the top percent, but of the fullness of this country? And Vlad, let's go back to you. We'll go the other way around this time.
Yeah, sure. I mean, I love the way that AT put it, right, which is that economic justice is racial justice at the end of the day. And in our data work at Gen Forward, right, we've repeatedly asked young people about different policies that they think would help them or that they support, right? And every time we ask these questions, right, we find that a majority of young people across race and ethnicity support, strong government interventions like the Green New Deal, right? Like free tuition at public universities, right? Like a universal basic income or a wealth tax in the way that, Senator Elizabeth Warren had proposed. And so there's strong support for these policies. And if we sort of learn from history, right, and if we turn an eye to the middle of the 20th century and what sort of closed the racial wage gap the most, right, they were these large sweeping policies like raising the minimum wage, right? Raising the minimum wage had a huge impact. It closed the racial wage gap by about 20%, right? And so if we can sort of push for these sorts of policies, I think that we'll see some really strong positive effects, right? And there's all sorts of policies that have been proposed, right? So there's talks of baby bonds, right, where babies are given, somewhere around $1,000 when they're born, they're invested right away, and then the government can sort of make graduated investments or contributions into those baby bonds depending on one's income, so that by the time somebody turns 18, right, they have a little bit of wealth, some more to their name than they would otherwise have. And the nice thing about this current moment is that we're actually having these conversations, right? We're reimagining the sort of policies that we could be talking about in a way that has been much more expansive than in years past.
Thank you, Vlad. AT, programmatic and policy solutions?
Yeah, absolutely. I definitely want to second everything that Vlad has just mentioned here and laid out. As he mentioned, being able to lift the minimum wage, being able to introduce more radical solutions like baby bonds that have us working more towards a universal basic income is crucial. We know that it takes the average Black family around 250 years to build the wealth to match the average white family. And oftentimes, the reason why that span of years stretches so large is because of those costs that come up that can really thrust an individual or family into debilitating debt or into poverty. So policies like baby bonds make it such that when someone turns 18, they have a nest egg to use for something like purchasing a house. Being able to do that not only ensures they are housed and safe and secure in a location, but also, as Vlad mentioned, that they're able to take advantage of this tool that has been a wealth building tool for many white families in this country for hundreds of years. And the policies, when we talk about UBI and we talk about stimulus that really reflects a lot more socialist policies here, that we really are talking about trying to even the playing field, making sure that every single family has an opportunity to stay afloat, to be able to afford that $500 expense at the bare minimum, and more importantly, to be able to ensure they have their basic needs met. And until, every single person in this country is able to find food and housing and healthcare and the slew of other essentials that they need to meet their basic needs, we're not going to be able to live out, our ideals as a country.
Thank you, AT. And just to name, a question came into the chat box around, was the survey offered around the country? Yes, this was a nationally representative survey. And before we move to Carla on programmatic and policy solutions, AT, if you could just name some of the internal and external changes that Equity has made in order to meet the challenges and needs of this time.
Yeah, absolutely. So much of what we've had to do over this last 6 months is ensure that our product is able to meet the needs of many schools. So we're a first of our kind company, right? Before we existed, there was no tech solution to provide emergency aid that was meant to scale across many colleges. And to give you some background, emergency aid does exist at most colleges across the country. It looks very different in every single college. But typically the way that it works is that, a student enters a office, they, in many cases have to perform their poverty and their trauma and making their case for why they deserve emergency support. And if they are lucky enough to receive it, they might receive those funds in, a week, 2 weeks, or some span of time that may make it harder for them to overcome that financial crisis, which needs immediate support. So, we've been making changes to our product to make it really easy for students to find out about aid, supporting our colleges with how they're marketing this to their students, to be able to apply. Our application takes under 10 minutes for students to, fill out and express their needs. And then lastly, to receive those funds. So usually it takes 24 to 48 hours for students to receive funding. So, a lot of what we've had to do internally is make sure that, we are solving for every single pain point that exists for emergency support as it exists on college campuses today. And as you might imagine, once colleges went remote, there was no student affairs office for a student to walk into to receive this aid. So, we are a tech-based solution, and the beauty of it is that it can work remotely, which is why, our team has grown from 8 people to almost 30 in the last 6 months. But we are really, really fighting to make sure that every single college has their needs met, and a lot of that really does look like making sure the product is doing the opposite in many ways of what a typical and effective emergency aid program looks like on a college campus.
Sounds like a concrete solution leading to more financially healthy lives of young folks. So thank you for the work that you're doing, AT. Carla, your input on programmatic policy solutions? And before you go, I just want to add, folks could add any questions they have into the chat box. We have a few questions. We have actually a bunch of questions coming in. So we'll try to get to as many questions by the end of the conversation as possible. Carla?
Yeah, I can speak on what some of our members have done. I think the one thing, going back to what Vlad was mentioning earlier of some of the policy changes, I think some of companies have been able to make very, changes that were needed for this time, starting with some of the companies increasing the minimum wage for their employees. And I think that itself is important to note. Also, a lot of companies are starting to really rethink about the benefit delivery. What are they offering their members, and are they also providing financial health support through their benefits, where there is emergency grants or with financial coaching to their offering. So we're seeing a lot of more companies doing that type of work to really support their workforce. And really, I think now a lot of, with everything that has happened over the summer, I think a lot of companies that are in our membership are rethinking of how are they showing up for the communities they're part of, how are they redesigning the positions that they have, especially for frontline workers. So we hope to see more of that. We hope to see more organizations and companies taking steps to make it more fair for their workforce, especially for young people.
Thank you. Appreciate that input, Carla. So we're going to move to audience questions now. And some I'm going to ask multiple people to answer. Some I'm going to direct at specific folks on the panel. So the first, and this is from Megan Skaggs, I'm going to direct to Vlad. A really interesting question. What is the role, what role does the rise in social media, shop now, pay later tools have in their ability to save? Have in young people's ability to save? But just broadly, I'm wondering your perspective, Vlad, on the role of social media on the financial health of millennials and Gen Zers.
That's a great question. Social media is kind of a double-edged sword, right? So first, let me sort of address the question that was posed by the audience member about sort of saving and what impacts saving. I think that focusing on saving, while intuitive and important, sort of misses the bigger picture, which is that, you know, a lot of young people, especially if we're talking about Black young people or Latinx young people, simply don't have the means to save in the first place, right? If you're worried about paying rent, if you're worried about, you know, housing insecurity, food insecurity, you know, student loan payments or educational debt in some form, right? Saving takes a back seat to that. And so the first step, right, is to ensure that people have money to save in the first place, right? I mean, there are interesting fintech companies and startups coming out now that sort of gamify savings and encourage people to save more, but that's not really the big issue that Gen Zers and millennials are facing today, right? They're sort of facing these larger structural issues in terms of access to capital and employment that are really best addressed by sort of macro structural policy intervention, right? The kinds that we've been talking about today, such as, you know, affording housing and so on and so forth. On the second point of social media, you know, social media is, as I said, it's a double-edged sword. On the one hand, you have the sort of democratization of information, right? Where if you're curious about anything, you can just Google it, you can watch a YouTube video about it, you can tweet about it, right? And sort of figure different things out, right? You have access to savings apps, like I've mentioned, and other sorts of things. At the same time, right? It's an echo chamber and all of the sort of negative things that we've heard about social media. But I actually do think that social media in this moment has been really transformative on the political side of things, right? So we've seen this rise in political engagement, right? At least sort of observable political engagement among young adults, particularly Black and Latinx young adults. They're on the front lines of protest for economic justice, for racial justice, for gender justice, for environmental justice, and they're increasingly involved in electoral politics. And one of the reasons for that is because of the very powerful organizational tool that social media is for young people.
Thank you, Vlad. Appreciate that. And yeah, very, very interesting question. And obviously, with social media impacting so much of our life, it's definitely going to impact any effort for us to build more financially healthy lives for young folks. Okay, so back to AT. We're getting a litany of questions from for Equity. Clearly, it's really intriguing work. It merges a lot of different spaces. So I'm going to ask you several questions, and I'll let you figure out how to weave them in. So one question about equity is: does equity provide any financial education, money guidance when giving out emergency grants to students? And then we have someone else asking, where does equity funding come from? And then how do you determine your partnerships?
Yeah, absolutely. So Equity actually started off as a financial literacy app that was intended to educate primarily high school students on how to better budget. So, you know, the reason why we shifted towards emergency cash grants is the exact reason that Vlad just mentioned. You know, financial insolvency is really the issue here. The issue is not necessarily that students don't know how to save. We've actually found that a lot of Black and Latinx students are good at saving what they have and good at using it, stretching their dollar to be able to work across multiple jobs and support their families, attend college, and also still find ways to, you know, ensure secure housing and food for themselves or their dependents. So I think that there is definitely a need for financial education, but, you know, to Vlad's point, the much bigger issue here really is trying to make sure people have enough money to meet their financial needs and their basic needs. So we definitely have a budgeting tool that is a part of our platform, but it was once the centerpiece and is now more of a nice to have compared to, the ability to apply for and receive a cash grant. So right now, as of now, we've given out roughly $5 million in aid to students. The majority of that funding has come from colleges' philanthropic funds. So many colleges have nonprofit arms that raise, anywhere between, tens of thousands of dollars to millions of dollars every single year to be used for a variety of different purposes. Oftentimes, those philanthropic dollars are used for scholarships to cover tuition. But more and more colleges are taking that nonprofit or foundation money and using it for emergency cash support. We choose our partners by basically whomever is willing to work with us, and we are for profit. There is a cost incurred by colleges to work with us, but our hope is that students who are able to receive cash grants are also able to stay in school as a result. So there is a win-win for the colleges that are working with us. It's a win for the students because they're able to receive those funds and hopefully stay in school as a result. We found that for Western Governors University, 90% of the students who have received funding are still in school as of today, which is really great news. And it's also a win for the college because they're able to retain their tuition revenue. So obviously there are many big issues at play here with, how much it costs to go to college in the first place. But before we can solve, that problem, and trust me, we are all advocates at Equity of tuition-free college. Before we can solve that problem, we really do believe that helping students stay in school through these cash grants is a great first step.
Thank you. And then the final question, and we'll go around on this one, and each panelist can answer it. But at the end of the day, it seems like what will be a requirement for the next several generations, unless we want to see a lot more uprisings, for this government to show up with a lot more integrity and eventually expanding the social safety net for all people. So that's the question. What could a more expansive safety net look like in the next several generations? And we'll start with Carla, and then we'll allow everyone to answer.
Yeah, I mean, from our side, working with mostly financial service providers, I think they can, and some are already doing something to make sure that we're closing gaps, especially amongst race and age. But I think this policy, there needs to be policy change, period. I think that, financial services providers, employers can do so much, but, again, we're going to be left in the same way that healthcare access has been completely taken away from people due to the lack of employment. I think we need to rethink on the way a lot of these policies are affecting people at the end of the day. I do think that we have seen a lot of these things tested out through, the pandemic, right? Like giving direct cash grants for individuals. We saw that people actually, use those fundings for what they needed, not what others. You always say that people are not going to use it the right way, etc. But people actually did. They needed, they were very mindful of how they were spending that money. We also have seen trends of people being reducing their usage of money during this time. So people know, and like going back to what AT said, right? People know how to manage their money, and especially during this time. And I think it is like, how do we make sure that we set up systems that continue supporting their financial health? And it also, if, workers and employers want to get into it, like, I think there's so much that they can continue doing, providing hazard pay, make sure that they are providing parental leave. It's such a big part of it, especially for Latina women and Black women who have been so affected by this, either providing care for an elder or for a child. And a lot of this is disproportionately affecting women of color. So The employers can do a lot, financial services can do a lot, but I also think that pushing more our policies to really reflect the needs of people of color, of women, I think can really lift up a lot of our communities.
Vlad, and then we'll end with AT.
Yeah, I mean, it's a big question, right? What does an expansive social safety net look like? And I think your imagination is the limit on this one, right? There's a litany of policies that have been put on the table, ranging from, you know, a universal jobs guarantee or a universal basic income, right, to, you know, smaller things like, you know, just maybe raising the minimum wage a couple of dollars, right? And so if you want to think about it like that, I mean, there's tons of things that we can do, right? As I've said, there's universal basic income, universal job guarantee, 2% tax on the net worth of those with assets over $50 million, 3% tax on the assets of those with over $1 billion, right? A requirement that companies pay a tax for every worker that they displace, right? The Green New Deal, free tuition at public universities. These are all policies that we've asked about and that we've heard from young people, quite a great deal of support for these sorts of policies, right? I think that one of the best things to come out of this pandemic was actually the CARES Act, which is, you know, a huge piece of legislation that actually supported a lot of struggling families, at least up until now, right? We'll see what happens, you know, after the year is over. But if we can sort of generate the political will to spend some of that money in some imaginative ideas, something like baby bonds or you know, maybe mortgage assistance or something like that, then I think, you know, we'll be on better footing in terms of the financial health and well-being of young people. Because again, right, as important as saving is, as important as financial literacy is, like, yes, we should tell people about a 529 plan and what the difference between a Roth and a traditional IRA is. These sorts of things are important, but they're not the thing that is really challenging people right now.
Thank you, Vlad. And AT, final word before we kick it back to Thea.
Yeah, I mean, I just want to echo everything that Carla and Vlad have shared. There are so many policies right now that we have an opportunity to take advantage of. And I think that one of the things that, you know, has been encouraging has been seeing how organizations like my own or, you know, in workforce or in higher ed have been testing out these different ways of privatized cash grants. That said, you know, this can never scale in a private way only. It has to happen through more federal funding, through more federal support, which is why, you know, as Vlad mentioned, the CARES Act was so important, and hopefully will set a trend to more stimulus packages that we'll see in 2021. So, you know, like we're in the business at Equity of giving money to people, and I think that as long as we are trusting of the individuals that are receiving that money, hopefully more stimulus packages can help, you know, really set a longer term trend of, you know, working towards UBI across the country.
Thank you so much. Thank you to all of our panelists and all of your brilliance in bringing so much light to this issue. Bringing it back to Thea from Financial Health Network now to close us out. Thea?
Perfect. Thanks, Jonathan. And huge thank you to all of the panelists, Carla, Vlad, Jonathan, and AT. Really an informative and an expansive discussion. So thank you all for joining this morning. I'm going to wrap up with just a few ways that audience members can continue to engage in this great research, as well as the wealth of data that we have on this population and others. So first and foremost, if you all have not had a chance to read the report that we focused on today, would highly encourage you to do so. It's available at this link on the website. Really a wealth of information that the panelists have just begun to touch upon today. Additionally, we think of this report as part of our larger series of financial health measurement, U.S. financial health pulse work. And so if you are intrigued by the measurement framework that we use in the report, would encourage you to explore the measurement framework yourself. It is free, open source, available to all on our website, link on this slide, and you can explore how you can use, again, this measurement framework to assess the financial health of your customers, your clients, communities or employees. Last but not least, there are other ways that you can engage, again, in the data from this report, as well as the wealth of the data that we have through the wider US Financial Health Pulse Research Initiative. You can request customized cuts, again, of this data or any of the other financial health data on different populations that we have. You can host a presentation or a workshop at your institution, especially if you are a member of our network. Even if you're not, if you're interested in having any of these folks come and talk to you, please reach out to myself or Carla. We can facilitate those introductions for you. And last but not least, if you, again, were intrigued by the report that we shared, if your company, your organization would be interested in sponsoring another type of thought leadership, another publicly released report on a different issue, a different segment of the population, we are always looking for partners and funders. And so would, again, welcome you reaching out to us. I'll leave you with our information. We don't have AT's information listed here, but again, myself or Carla can connect you directly with him. You can reach the Gen Forward folks via their email address. Our email address is on the screen. So thank you all again for your participation and your attendance this morning. Really appreciated the audience engagement. Hope you have a wonderful rest of the day. Take care.
Thank you, everyone. Bye-bye.
Thank you. Bye.